All right. Well, welcome everyone. I think this is the fourth doc talk that we've had, so we're starting to get a kind of a cadence to this. And I always like to start out by just kind of giving you guys the rundown of the tools in case you have not seen this or you're new to the company. And so, what we want to do is walk you through what we call our doctor's reference. And this has been a really great tool. You know, as we came on board and started this back now almost 12 months ago, 11 and a half months, we really wanted to focus on the medical side. You know, we knew how much you guys gave us credibility. And if you believed in these products and we could make them organic for you, then it was going to help. It was going to help the brand. And we know as brands grow quickly, people are always, you know, that everybody comes in a skeptic. And so, you know, to have you guys on board, utilizing our products, seeing results, we now have a lot of doctors that are coming on board to do clinicals and case studies and all kinds of stuff. So it's been a lot of fun just to watch this grow. And as you're going to hear from some of our guests today, I mean, we are seeing on a daily basis, onboarding dozens and dozens of doctors. So I want to walk you guys through this and just show you guys the tools that we have. Now, what I wanted to, when we built this was to really have doctors that were pitching doctors instead of us as salespeople pitching you guys. Even though we knew we had a good product, we wanted to make sure that it was coming from you guys. And so you're going to see Dr. Todd, which if you guys were on last month, you got to hear him speak, and just a very, very brilliant man. He does a lot of stuff with athletes and you know, in that industry. And so he comes on and really shares the individual products themselves, the raw ingredients. And then you can also click on the clinical studies on the raws as well. As you're walking through this process, one of the tools that has helped us a ton is making it organic when you bring it in your four walls. Understanding that every clinic operates a little bit differently. And so we have 3 different options. And so if you're ever looking for your own, you know, your own clinic, but you're also pitching this to somebody else and they don't quite understand how they could do it organically, have them watch this video because it's super powerful. I had a couple come over the other day. They're in the medical field. As soon as they watch this, they're like, okay, I want to do number 2. And then we started rolling from there. The other thing is if you are a number 2 or a number 3, we're going to be bringing products into your 4 walls. And so we have something called a customer fulfillment account that the video will explain. But if you click on this button, it will also pop up the information that we need, because we're going to treat you a little bit differently than the average affiliate that's coming in. So you're going to have your own affiliate account, but you're also going to have a customer fulfillment account. And again, the video will explain that stuff as we go. The other cool thing is, and you're going to hear from somebody today, one of the you know, those in the medical field, that it's been a really cool building of a culture where everybody's kind of pitching in and helping each other and giving each other tools. You don't see that too often. You know, we see a lot of us competing with somebody else, or, you know, you have multiple chiropractors in a small area. Well, what we're finding is this is actually bringing that culture together because they're helping each other and they're benefiting from the collective. And so if you're in this book, you'll see at the top of most of the pages, there's going to be a little drive button up there that will open up a lot of the different tools that those that are in this are donating to the bigger cause. Okay. One of the other things that we taught on last month, so if you didn't get to see it, go back and watch it, is we had a specialist in the GLP, GIP protocols. He kind of walked everybody through not only how to utilize synthetics and what they do, and how to microdose, but also how to bring ours alongside that. And so that has been a huge topic. I looked up statistics last month, and it was 1 in 8 Americans right now are utilizing a GLP-1. Now, we know there's some really good doctors out there that understand how to utilize them, and then there's some that are just jumping on board. And so I think what we've tried to do is come alongside them and work alongside them to educate on how to utilize those, if they're already using them, how to use ours in conjunction, where it actually benefits the client because they increase their lean body mass, if not maintain their lean body mass, decrease inflammation, but also gives them the chance to have a revenue stream when otherwise they would have to cycle off the synthetics. So again, there's a booklet that's attached to this button. You just click on it. It's going to walk you through the process, what products are best if you're utilizing GLP-1s, GIPs. And then it also gives a couple examples of those that are utilizing this in the revenue stream that it's bringing. So just a really good tool. At the bottom of this page, I'm really excited. We got the NSF testing coming up. So there's informed choice for our type of products. There's informed choice, and then there's NSF. Both of them are very good, but you have to be in manufacturing for at least a year in order to get these certifications. And so right now we're at 11 months. We just had our first, the hydrated product just went through. And so that one is now on the NSF. The other ones are to follow in the next 60 days. So just knowing that, it's actually helped us to reach out to a lot of those that are in sports and those that just want to make sure that the testing is at its highest level. To give you guys, if you know that are worried about this, or this is a concern, we're in NSF factories. So we have 3 different factories because we've grown so fast. We need that many factories to keep up. But they're all NSF. So they're going through the protocol as they're being produced. And so we're trying to do things at the very highest level, knowing that how fast we're growing, all eyes are on us. All right, a couple more things, and then I'm going to turn it over to some testimonials. We're working on a Facebook group. So last month, I promised you guys that we were going to have a Facebook group. We want to have the right structure in place and also a foundation of leaders that are in our marketplace and then also in the medical space as well that kind of oversee it so that if questions are being answered or being asked, they get answered. We're putting in the appropriate information so that you guys can be updated real time. All those different things are very important. And so it takes a little army to run that. So we will have that up and running this month. Just wanted to let you know that that's coming. One of the things that we're taking off of this book is we had a button for doctors' personal testimonials. And so if you clicked on this button, it would go to a page. You could lift those stories, and most of them were videos. They're amazing stories, but what we decided is that we wanted to move into a space where we're collecting hundreds and hundreds and hundreds of testimonials, both on the medical side, their case studies, their patients, also in the fitness realm, their clientele, as many as that we could get, because it really doesn't matter how much testing you have or how well you say the products work if you're not showing testimonials. And so we have hundreds and hundreds and hundreds of pictures, but we don't have the context to them. So we created this tool so that we can start to pass this out, and it's already catching fire. So if you guys have testimonials, anybody that's listening to this, if you have a personal testimonial or if you have somebody that you've helped, make sure that they make sure you click this button, you get this, this document. And then on the very back of the document, there's a submit button. So not only can you use this as a tool, but you can also give it to your team so that you can collect testimonials, and we'll be putting these in every single month and updating them. So just again, we're trying to add as many tools as possible just to solidify not only that the products work, but again, there's always skeptics. There's a million things that people are launching out there. And so we got to make sure that, that we're matching the testimonials with it. All right, last button on this page, the DocTalk questionnaire. So if you're listening to this and you have either a testimonial that you want to give, you have a question that you want to ask, every week what I do is I go through and I look for what are the top questions that most of the medical field is asking. And then I try to bring on the right doctors that can speak to that. So for instance, this month, we have a special guest on here that she is just doing a phenomenal job of influencing the medical staff, the fitness category itself. And so she's going to start to share with you guys, just some of the things that she's doing to create this flow. And I can't tell you how many doctors and those in the medical field were just saying, hey, we know the products work, but we're having a hard time talking to our colleagues about this. And so I wanted to bring her on. And again, we just take that very serious of, what are you guys asking and how do we answer those questions? Knowing that sometimes when we're really good at one thing, we might not be as good at the other part of it, right? And so sometimes we're really good at our trade, but not good at sales. And so how do we fill that gap? All right, last thing, and I'm going to go to a testimonial, If you missed any of the doc talks, we now have a button where you can watch the replays. Or if you see this and you're like, man, I have somebody that really want to watch this and you can utilize that as a tool, you can always go to this button, click on that. On the last page is going to be the live button that brings you here. But this page will have that. And then you can use this for a tool as far as building your business, but also kind of marketing at the same time. All right. If you don't have the book, take a picture of this right here. This will make it super easy for you to have access to the book itself. We'll be constantly, it's real time. So as we update it, you guys, all you have to do is refresh it. It'll update on your side as well. So we'll continue to add, to this over the years. All right. I'm excited to bring on Christina Sinclair. As I was talking to her, again, you talk about skeptics in this business. I was a personal trainer. I was a nutritionist. I owned a gym. I was a IFBB pro, and I was pitched things constantly. And so I was one of those skeptics when I first started out, and it took a long time. My wife actually is the one that pitched me our first business. And it took me a long time to really get on board. But as I started to understand what she was doing, how many people she was helping, it totally changed my perspective. And so Christina has a very interesting story to tell. And I think these are the most powerful ones, is when you have somebody that's a little bit skeptical at the beginning, and then they start to turn the other way and start to become very powerful in this business. So Christina, will you come on and tell us a little bit about your story?
Sure. Hey guys, I'm Christina. I am a nurse practitioner. I live in North Myrtle Beach, South Carolina. I am on Team Making Waves with Lindsay Isham. Talk about skepticism. That was me. I am the hallmark of skeptic. I always need proof. I want, facts. I want evidence-based articles. I want to see the clinical studies. I will not try it until I believe it. So my mentor, Carrie Walker, had come to me back in October, asked me what I thought about these peptides. And I was like, well, they're little pixie sticks. They're not anything. And she goes, no, I want you to read about them. I said, I don't want to. So she came to me probably once a week from October until February 24th. And she said, I just want your opinion. I want your advice. I do practice internal medicine, but I also practice integrative medicine. And I was like, fine, I'll look at it. So I did all the research. And again, it took me a long time because she doesn't know this, but behind the scenes, I was looking up these peptides to see what they were and what they could do in the body. And I realized, wow, these are awesome. So I did a trial run on myself, ordered the peptides, started taking them. I'm also a power lifter, so I wanted something that would help me with the inflammation. I'm always tired. I've got 3 kids and a husband that works a lot. So I wanted to try it, tried it, felt great. And I was like, that's placebo. It's nothing. So I came off of them. I felt bad again. So then I was like, I'm getting back on these. And I've been a believer ever since. I also brought it into play with my integrative medicine business. I have a lot of people who have autoimmune conditions that come to me. Hashimoto's is thriving in this area right now, but a lot of people that are coming to me just saying, I don't know what to do. So at our practice, we both are we think very highly of these peptides, and we have used them to just see lives transform. Same with friends and family. I actually have a coworker at my other job that her husband has, oh my gosh, I just lost what he has. I forget. Anyway, he could not sleep at all. He got up every 2 hours, would go to bed around 11:30, wake up every 2 hours and get up at 4:30 for the day and just say, I can't do it anymore. He started taking Calm, not even the sleep peptide, and now he is able to sleep. He texted his wife today and said, I slept from 10 p.m. to 5 a.m. and I've never felt better. So just getting these stories, putting down, having people say they have their lives back, myself having my life back, having my energy boosted has been tremendous. And through all of this, I've been very fortunate to reach out to others in the medical community, physical therapists, chiropractors, massage therapists. I actually am already in cahoots with gym owners, and everybody's beginning to use these peptides and seeing the same results in their patients and their clients. So being able to be a small part of the movement that's so big and changing lives with these really great tasting tiny pixie sticks has become absolutely incredible, and I'm thrilled to be on this ride. But I also appreciate all of you in the medical community and on this call that are available for, if we have questions, you can throw them in here. I really am grateful for that, hearing your testimonies, hearing how you use it in your patients. I think we've got a really bright future ahead of us, and I can't wait to see how this continues to blossom. Thanks, Nate, for asking me to come on.
Oh yeah. Well, thank you for sharing and talking about the calm. So we were just at an event down in Texas, and I had three different doctors come to me and say, "Hey, did you know that the calm, if you put it in hot water, it actually works better because it's designed to be sublingual, but because it tastes so good, a lot of people are swallowing it too fast." And so just almost making it like a tea, making it with hot water. Well, actually, they're saying and I tried it. It probably, I would say it 10x is like how you feel and how fast it hits you. So that's a great one. And for those of you that are listening that maybe hasn't tried all the products, my wife and I were just talking to, I think three different doctors, about an hour and a half ago. And one of the things that they use a lot of the GLP ones and a lot of the synthetics, like BPC and those types of things. And we just got to talking about the experience of the products and how when you taste something, how it creates a habit versus, I was telling them how I had an issue with my neck. I had to have two discs replaced. And I was taking BPC 157, TB 500. And as soon as the pain went away, I started forgetting to take it. Right. But I still needed it. And that's what's great about our products is because they have a taste to them, they start to create those habits. So anyway, thank you for sharing. I appreciate you so much.
Thank
And
you.
yeah, you bet. And you guys, I can't tell you how excited I am to bring on Melanie Abert. Now, I just got to know her probably what's it been, like 3 or 4 months. We've become closer as we've started to work together, and just her energy. Melanie, unmute yourself and come on. She's going to give you a little of her background, but she has been so intricate in helping me to build out some of these tools and also just bringing on a massive amount of those in the medical field. And so, Melanie, if you could share a little bit about your background and kind of how you got into the medical space a little bit, and then we'll kind of dive into some questions because, again, the more that I was getting questions from the medical field that were filling out the document, the form, they were all asking, or a lot of them were asking, I know that these products work, but how do I have the appropriate questions to get other people interested? So, Melanie, let's turn it over to you.
Sure. And thanks for all the work that you've done for this community, Nate. I think this call right here is so important to bring other like-minded medical professionals together. I always give the disclaimer, I'm not a doctor, I'm not a scientist, but my background, since you asked, is broadcast journalism. And I did that for more than 10 years. I was a news anchor and a reporter in several major network affiliates across the country. And then I got into business and became a mother. And then I started doing some podcast work for a hospital, a huge hospital here in Baton Rouge, Louisiana, Women's Hospital. I did a 2-year series of podcasts for them. And then I've hosted telethons and some of their online series as well. And so I had a lot of discussions with doctors and formed great relationships with them. But in the meantime, I had my own experiences with holistic health. And that's a whole different conversation for a whole different story. But what I found so intriguing when I learned about Make Wellness was that I could bring the clinicals and the information on this company and these products to the medical doctors as well as the holistic practitioners. And they were both equally as interested because I had the clinicals, but I also had the ingredients that were clean. And to me, that was very rare. And I had become very frustrated over the past several years in learning that when I would bring possible solutions in holistic health to medical doctors, they would really brush me off because that's not necessarily their area of expertise, but a lot of them now are turning more towards possible solutions in prevention and in holistic concepts. And so I'm glad to see that change that's happening in our country. And so I'm really excited to be a part of that. And that's really what made me feel a real responsibility in this effort because I didn't want people who had those high level credentials to brush this off as some fad in direct sales because it's not. I mean, the science behind it is incredible. And so I really, for the sake of the entire community with Make Wellness, I wanted to make it easier for Sally down the street to have a business, not harder. I wanted to make sure that we built a foundation of people who were instinctively trusted when it comes to health and wellness, whether it be fitness professionals, holistic practitioners, or medical doctors, because they all understood right away the future of peptides. They know that this is really an on-trend topic, and they know why.
That's great. So when you're reaching out to different types of doctors, kind of explain your mindset. Are you looking for those that are already using synthetics, or just give me kind of a peek under the hood of when you're targeting, I guess, the medical field. Like, what do you look for?
Well, the first doctor I called, I mean, I went to the most influential doctor I know. He was on the Dr. Oz show for 11 years. And he was one of my colleagues in TV news. He was our medical editor, Dr. Corey Berry. He's in one of your testimonial books, and he's in our flip book, of course. And so I just ripped off the Band-Aid. I'm not a doctor, and I didn't go to med school, obviously, but I ripped off the Band-Aid, called the most influential doctor I know. First call. And I said, I just said, he's a friend. And I just said, Corey, I assume you know a lot about peptides. Do you know anything about peptides? Do you work a lot with peptides? And he also has multiple businesses and owns a clinical research facility. So, he's really plugged in. And he said, yeah, of course, peptides is the big thing. And I said, you're probably talking about synthetics, right? And my strategy is usually to ask questions, not to give a sales pitch. I don't give a sales pitch. I really call people who I admire, who I respect, maybe who I have a personal relationship with, or who were recommended to me. And I ask questions about their knowledge of peptides, their experience with peptides. And then the more questions I can ask, and the better understanding I can get of how they work with peptides, what their experience is, the easier I can transition into, well, do you know about bioactive peptides? Have you heard about this? I think this would interest you. So decided I should let you know about it. I think it's something you'd be interested in knowing about. So that's how I transitioned. That's how I made that first call. And I'm really a person to person, a phone call. I mean, I do this the old school way, as opposed to sending messages, with copied and pasted messages. I don't do that. I get these doctors on the phone, or I visit with them in person, and I just ask those questions. And so that's how it started. And that's really how it has snowballed since then. I do a lot of three-way calls, for my team. They'll ask me to talk to different doctors, and three-way calls are duplicatable for anybody. And then you'll hear from Dr. Amy Russo-Monger, who's actually a dentist, and we'll talk about how we've been kind of growing in her practice as well.
Yeah. Have you, just because I have these questions out here, you've answered, some of them, but have you done any cold reach outs, or are they all warm market?
I did the other day, but not usually. It was only because I was passing by. I went to dry cleaners, and there was a chiropractic practice right next to the dry cleaners. So I said, "Oh, let me go in and see what this is about." And I just talked to the chiropractor was obviously in an appointment, but I talked to the front desk girl, and I just said, I've been working with a lot of chiropractors across the country with these new peptides. I think you guys might be interested in them. And she said, "Oh yeah, I bet he would be interested. Send us some information." That's the only quote. And then there was a pharmacy, literally like a locally owned pharmacy, on the other side of the dry cleaners. So I walked into there as well and did the exact same thing. The owner wasn't there, but I just asked to speak to the owner, and I said, "I think I have something you might be interested in." Well, the front desk girl was obviously intrigued because I asked about Ozempic, semaglutide. They were carrying the synthetics. And so it sparked those conversations. I don't typically, I haven't made it through my own network yet. I mean, I feel like we've barely scratched the surface. But I would have no problem, doing a cold reach out like that. It just so happened I was just passing by. I think the credibility comes with the relationships, at least in the beginning. And so, like I said, if it's not your own relationship, I mean, all the people on this call are medical professionals or are linked very closely to them. So we are all in a community where we know a lot of doctors, and I also think we should start with the people with whom we give our business. Concierge doctors are great because they don't have to go through all the red tape. If they have their own concierge, like the VIP doctors, they have their own practice, they can do whatever they want. So those are really good, those little boutique services. But there are others. I have others who can't necessarily carry the peptides in their practice, like Jenny Baker. Dr. Jenny Baker is the front of our medical flip book. And she's great on camera. She really has a passion for holistic health, but she's an emergency room doctor. So she's not selling peptides or talking about the business opportunity in the emergency room, as you can imagine, but she's taken that opportunity outside of the hospital. So it's not necessarily that she's growing in her business or in the hospital, but rather she has those credentials as a medical doctor. And so, people have a great level of respect for her when she's having the conversations outside of the hospital. So it's not always in the walls of the practice.
Yeah. So we were in Dallas 3 weeks ago. I believe you had about 45, 50 50 different partners there. The majority of them, I think, were in the medical field or / probably fitness world. Do you leverage one to get the other? You know, are they separate kind of conversations? Like if we have somebody that's on here that has a bunch of medical staff, do you feel like that gives them an edge to go out and have conversations with the fitness world as well?
Sure. I think there's strength in numbers, and people start to get a little bit of FOMO. Those first few calls, those first few partnerships are the toughest because you're in the as a doctor, you're not necessarily equipped or skilled to have conversations in sales. I don't consider myself a salesperson. I'm an educator. And that's what I did in broadcast journalism. And I don't feel like I'm doing much of anything different. You know, I'm connecting people and educating them. And I'm not tied to the outcome, you know, but what I have found is that most of the doctors in my team, and we have quite a bit of them, you're right. Most of the doctors on my in my team or my organization they're not really doing this for the money per se. They are fascinated by the science, you
Mhm.
know, and so they don't have direct sales backgrounds. They're not trying to grow a team, but it brings an added level of momentum, I think, to have that credibility and
Mhm.
diversity in our teams. And when you bring up the fitness professionals, yes, I have deliberately, again, okay. So I said I went to one of the most influential doctors I know. I went to one of the most influential fitness professionals I know, Todd Durkin.
Yep.
He is trainer to Drew Brees and Jordan Love, and you know, he trains the best athletes in the world. So back in October, he was one of my first calls, and that was you know, usually people were very influential. And you mentioned this when you were IFBB Pro, and when I was on television every day, you know, you would get a lot of pitches, and Todd does too, you know, but
Yep.
he knew right away. I did the same thing with him. I asked him questions. Hey, do you know about peptides? You probably know about peptides. And I knew Todd from my broadcast journalism days. So we had a relationship. I covered the Super Bowl in Miami when the Saints were in the Super Bowl. And so I
Mhm.
met him because I interviewed him as Drew Brees' trainer, and we kept in touch. So it was really more about the relationship. And he was so excited about peptides, but he hadn't heard of bioactive peptides. So we have the privilege of getting to explain to these professionals, whether it be fitness or holistic health or medicine, what they are, and they understand the science behind it very easily. They don't brush it off as a fad, you know, as other people might. That's why I specifically targeted people I thought would understand peptides, and I could have those conversations right away and not necessarily speak in full their language, because I don't speak medical jargon necessarily. But I would go to them because there's somebody I respected in that field. And I would say, you probably know about this. And if you don't, you probably want to be among the first. You know, I think you're going to be interested in this. So that's really my approach with those three industries.
Well, and for anybody that's listening, if you're having a hard time right now, because again, I know sometimes we're really good. I was like this when I first was a trainer. I was a really good trainer, really good nutritionist. But then I had to learn how to sell because I looked at it as selling versus connecting to a solution, right? And so let me ask you, if you're going to give one tip to those that might be struggling right now, what would that be? If you know what I just explained, you have somebody that's really respected in the medical field, yet they're having a hard time getting people to take a look at this, whether it's their own clientele or it's another doctor or medical, you know, somebody in the medical field. What would you say?
My biggest tip is always, and in this case as well, ask more questions, ask better questions. Don't do a sales pitch. Don't give a sales pitch. Ask questions. And then, you know, write down a couple of phrases that are most meaningful to you. For me, when I first learned the story of Make Wellness, and I didn't understand peptides when I started this, you know, and I did some research. And I remember writing down, I knew the significance of double blind third party human clinical trials for most of the past decade, but that wasn't part of my everyday language, that phrase. So I remember writing that down so that when I called Dr. Corey Abear, I knew that would be important to him. And so I wanted to remember to say that. And I also feel it's important to say stories. So for instance, with Dr. Corey Abear, I told him a story. Once I got through those questions, I said, well, let me tell you what happened. You know, I got this call from a respected friend who told me about this company, and I told him a very brief, like 1 minute condensed version of there's this lab in Ireland using, I told them about Neurotos. I said, there's this lab in Ireland using AI technology to identify and isolate these peptides found in nature. It's fascinating. But I had to write that down the first time. You know what I mean? And so those were the two phrases: double-blind third-party human clinical trials, and this lab in Ireland using AI technology to identify and isolate bioactive precision peptides. And now it rolls off of my tongue, but that's kind of what I would go to once I passed through the questions and I moved on to the story that I was going to tell them about what happened in terms of how I became involved with this and why I think they would be interested. That's my biggest tip. The better questions you ask, the more questions you ask, the more you can tailor your conversation to that practice's needs, that doctor's needs, that fitness instructor's needs. Like Todd Durkin, for instance, said, we've been wanting to bring peptides into my gyms for years, but they're so complicated and you have to bring a medical professional, and this might be a great solution, you know, but listening to whatever their pain point is or the reason why they might be interested, if it might be something other than they just would like to be in the vanguard of the new science or the new knowledge behind it.
Yeah. Well, and I would also suggest you guys leverage, like she talked about stories, leverage stories of those that are bought in, because Todd's a great example. Todd has a supplement company. He has a supplement line, but yet he's utilizing this as well. And he doesn't feel like it competes. And so those types of storytelling and education and name dropping every once in a while, like, helps a ton just to open up that door so somebody will take a look. So, all right, I'm going to turn it over to you. So now you can lead this conversation, because this is a partner of yours. And so excited to hear from Dr. Amy.
Speaking of stories, this is a great story. Dr. Amy Russo-Munger, will you wave? She has a great story. Okay, but I'm gonna start off by saying we all know about a dream team. I think do doctors know about dream teams? I think they do. Maybe you don't. A dream team when you start a business is basically your dream team. If you could partner with anybody in the country, who would you pick? Dr. Amy Russo-Munger is a dentist in Baton Rouge, and she's one of the people I actually had on my dream team. And I just hadn't had time or made the time to reach out to her yet because the business started taking off so quickly. So a few months go by, and a 50K visionary on my team, Jill Williamson, had hosted an event for medical professionals, or she was a vendor rather at the event. It was hosted by Dr. Gunjan Raina, who is now in our organization as well. And it was a happy, healthy hormone event. And Jude Marino, who owns Louisiana Medical Group, had a table there right next to ours. So Jill just was a vendor for Make Wellness, and I went to help Jill. She's on my team. Jude Marino, who owns Louisiana Medical Group, was giving away free NAD shots right next to us. So when I get to the event, and Jill put up some money to, a few $100s to do this event. And so this is a great lesson with these events. And she says, oh, this guy next to us is giving away NAD shots. Oh, he's doing synthetic injections. And I said, great. We made friends with him. He's on this call right now. And he does nothing. It's a weight loss clinic. He does nothing but synthetic injections over there. So I said, once we became friends, and we realized we had some connections in the dance world. Our daughters dance together. I said, Jude, do you realize that 40% of the weight that they're losing is from muscle mass? And he said, well, where's Jude? Is Jude online? Can you wave? So Jude says, well, we educate them, we tell them, we take the precautions. And I said, but are they all following? Are they taking enough protein and working out enough to offset the amount of muscle mass that they're losing? And he's like, no, they lose a lot of muscle. And I said, what if you could at least offer them fit? Because what we learned is we don't want to vilify the synthetics. We want to work with the weight loss companies that are giving the synthetics. What if they could at least give fit to avoid the loss of muscle and hydrated? So a few months later, so he became a partner of ours. A few months later, he tells me at the dance studio, hey, Melanie, I got to tell you something about business. Do you know Dr. Amy Russo-Munger? He says, we're partnering in a wellness clinic together. Well, she was on my original dream team and I never called her. I said, I'm going to call her right now. I'll get her on your team. So I called Amy that night. Amy is an old friend of mine. And Amy, you already, this is, I wanted to set that up because I think that's really important to hear those possibilities. But as soon as I called you, you were interested. And so my question to you is, what sparked your interest in peptides to begin with, to want to start a wellness clinic with Jude Marino? Because you're a dentist.
Yes. Thank y'all both. I'm so excited to be on. But yeah, my son is a personal trainer, and so I started, of course, so that I could see him, worked out with him 2 days a week, and then I was microdosing GLP-1s. Dr. Rania put me on them because I was taking metformin for cortisol out the roof, all the things. I was pre-diabetic, not really for weight issues, but I think it was more of a cortisol issue for me, just high stress work, high stress exercising, doing too much. So she says when that came out, she goes, let's flip. You're not taking your metformin like you're supposed to. Let's flip to this. Let's do a small dose of this. And so that's kind of how I got on the GLP-1. I mean, of course, I think probably all girls were like, yes, I'll lose some weight. This is great, And then I've just kind of stayed on it as a microdosing. Well, my son was not happy about it because he's like, you're going to lose all your muscle. This is terrible. So it kind of got him looking at it more, fussing at me more. And then it started me thinking about it more. And so that's kind of where we started, was for myself, looking into it. And so we did a lot of research. He would look at podcasts. He'd pass it to me. Another guy in the gym has been a trainer for years and was like, he is like the dictionary for peptides. So we just pick his brain, and that's how it kind of started with me. So I was like, you know what? There's a lot of people on GLP-1s. They're not doing it correctly. The doctor did not tell me these things, and it's nobody's telling these other people. And so I said, let's do this right. Like, we have so many people that are unhealthy. So we are, I think, the third, and Jude told me this today, and I want to say this is right, the third fattest state in the
Oh, Louisiana. Yeah. We're
yeah.
one of the fattest.
And he could probably tell us he's got gazillion patients on GLP-1, but we're still the fattest state, So it's like, I mean, we have good food, but it's needed to tell these people what's actually good. So yes, GLP-1 can be very good, but there's tons of other things that we can do to make these people healthy. I see sick people every day in the dental chair, and not from dental issues, some from dental issues that are going synthetic. I mean, systemic going in there, but it can be on the synthetic peptide, the GLP-1, and still not getting healthy. So it was just something for me. I've always been really interested in health and wellness for myself. It's just been something I've always learned. I've always been athletic, a dancer. That's how we met originally. So I was able to pick up on it really quick. It was something that really made me happy and interested, and I wanted to help my patients be able to get healthy all the way from top to bottom, from their mouth all the way down, and help them understand it. So doing more research, looked into it, like you said, talked to Jude. We were going to open up it was already in the process, opening up the wellness clinic where we do not just GLP-1s, but go through the whole list of all the things that patients could use to benefit tons of different things besides just weight loss. And then when you came into the picture with the natural ones, I mean, I normally go more a natural route than I would do prescriptions, and I'm more preventative and holistic than I am to do reactive and prescription. So it spoke my language right away. And I knew that having both things in my, in my back pocket were always better for my patient, because I don't want to have just one way to help the patient. I want to have both ways. And surprisingly, y'all will be happy to know, I do questionnaires with both things. I give out the questionnaire, I take the questionnaire, I go through it, and I'm like, okay, these are the things that you're concerned with. These are the things that can make you well. I can have these that you could do, shots, injections, and I have these natural things. Way more people are interested in the natural than the synthetic.
I love
I
it.
was shocked. I really was shocked because of the fact that I know so many people that are on the GLP-1 injection in town, and just people in general. I really thought that was going to be that the bioactive ones were going to be harder to push on people, and it's really has not been. It's nice to have both, but most people want to do the natural. And then I also usually tell them too, if they are on the GLP-1, I always push the fit and the hydrate. And then I tell them, when you're ready to get off of it, let's microdose you off of that. If your doctor doesn't want you to do it, talk to me, we'll do it. And then let's get on lean. And that way you're still watching some of the weight. And then as you do that, you're, of course, picking up those better habits, we hope, of eating more protein and then doing the workouts. So I feel like I have a way to help the ones that are even just, Jude's patients, people that are on the GLP-1s. We don't want to tell them not to be on it, but at the same time, like you said, we've got to give them a way to stay healthy and make good, the synthetic one's fine, but let's pair it with some things. So really in Dallas, I was sitting there and I was next to Jill, and I said, I've got a great idea. I said, I'm going to sit and I'm going to look at the GLP-1s the synthetic peptides that I'm using, and I'm going to put down all of the things that's needed next to it that is a great pair for the synthetic to pair with our make products. Because if you do, I did a whole certification, Jude and I both did, with Empowered Academy. And so you get certified, and it tells you all of these supplements that they want you to take with it. They're like, if you're taking this one, take a magnesium. If you're taking this one, take an L-carnitine. A lot of the things that y'all already have, that we already have in make, are in supplements that they're telling doctors to, and whoever's going to do peptides, telling them to pair with it. And so it was so easy. I was like, this one needs this one. And I have my own little cheat sheet of, what goes well together and pairs to do the best. So,
and you mentioned Jill. I know Dr. Bartlett's going to talk in a minute, so we need to pass it on to him, but I know this will be really helpful for people. And Jill Williamson and I work together really closely as partners, and she's done a fantastic job in setting up a beautiful display, which I think you've passed on the pictures to Nate so that people can use that as an example of you have the retractable. Jill had a graphic designer. She worked very meticulously on this, and she's got a beautiful display for vendor events too. It's a real good strength of hers. But something else that you do the onboarding, like sort of like an intake form. When the patients come in for the dental practice, because you have a big, beautiful, brand new building. So you have the anesthetician you just hired, you have the wellness clinic, you have the dental office. And when the dental patients come in, you have them do an intake form like the peptide pairing quiz. And they're doing that all virtual, correct?
Yeah, they can. Yeah, it's a DocuSign. I do one a DocuSign. Then there's one that's just the make quiz. So if it just kind of, I'll ask them how involved they want to get, because the intake form that I decide whether it's synthetic, not, or both, is a longer form than if they're like, I don't want it at all synthetics. Then I just send them my really quick make quiz, and then sometimes I'll send both. But
And
yes.
because it's so awesome, you have offered to share that with the medical community here at Make. So I know Nate's going to include in the resources. Guys, you have to get to know Dr. Amy Russo-Monger. She is just a bright light, a wonderful person. But then the other two things we talked about that were so important is that we always want to prepare people that they need to give, if they're trying to lose weight, especially 12 weeks. If they're going to come in as our customers, we want them to commit to 12 weeks, because we talk a lot about cellular turnover. It can take up to 90 days. And so it's about setting those expectations. We want to underpromise and overdeliver. But the second thing is the body composition. So tell everybody what you did to make sure that people can track their body composition so that they know they're not losing muscle.
So Jude and I bought a scale, a body composition scale. And so we have that there, and we offer them a free scale or free session, whatever it's called. You get it on your phone. It's you have all of it. It shows you where your fat levels are, where you're losing your muscle, your lean muscle, and it's called Shape Scale if you want to look it up. And they can come in, they can do that. I try to tell them that they need to come in before they start, or right when they start the peptides. Then they can get their baseline. In a month, redo it again, and you can see where you're losing, where you're gaining lean, losing lean, and then at that point I have something to go on. If they're like, oh, I just want to take the GLP-1 and do nothing else, and they start losing lean muscle, then I can say, look, you're losing this lean muscle, you've got to add in some fit, and some hydrate with it. So it gives me a leg to stand on, gives them some proof of what's actually happening. So we'll do that. We also will give them a glucose monitor if it's something that's interesting to see, like what their glucose is doing as well, to kind of see if we can balance them out. So they get those two things with their membership for free, and then they can just come in continuously and do the monitoring. So it's been, I've done it already. I've done like a 1 month. And so to see the comparison, it's pretty interesting.
And then there's your marketing material to post. Yeah.
Yes.
So we also did an event at your beautiful new business, and we're going to be doing those regularly. So that always works because you get a lot of people in at once, and then she hired a production team to come out and film it. So that's when you can actually learn more about Dr. Amy Russo-Monger, and you can contact her. I'm sure she wouldn't mind. I think she wouldn't mind. Sorry, I'm advertising.
She's gonna get 100 people asking her.
Yeah, it's Smile Spies. The Smile Spa is the name of her dental practice, and the wellness business that she just started with Jude Marino is called Smile Spa Wellness, and she has a podcast. If you're really interested in hearing a little bit more about what they're doing and how she's integrating Make Wellness, you can look up her most recent podcast. She and I did one together all about Make Wellness, and prior to that, she did one with Jude where they talked about both the synthetics and the bioactive. I went and sat in to make sure they talked about bioactive, but you see, now we got a turn. Now they're favoring the bioactive now. So thank you so much for sharing your bright light and your expertise with everybody, because I know that they can all take advantage. You can actually see your office right there. That's an example of the display in the slide that Nate put together, and then the podcast on the left. So thank you again,
Thank
Dr.
you, ladies,
I
so
want
much.
Nate and Jennifer on another on a podcast eventually.
That would be great. She would love that
Yeah.
for sure. Well,
All
thank
right.
you guys so much. And we're going to pass the buck over now to Dr. Mark Bartlett. If you haven't met him yet, he's the head of science for our company. And Dr. Mark, before we get going, before we dive into the sleep and the recovery and the Restore product that we're about to launch, and really talking about the depths of that and how it's going to impact people, can you come on and give us just a little bit of your background, kind of share the history of what you've done in this industry, and then also the different types of people that you've worked for? I think that's really important to kind of set this up.
Sure, thanks. Yeah. Well, it's been really fun, first of all, to listen to you guys. Wow, I'm just like so impressed with the creativity and the professionalism that I've heard here tonight. You guys are amazing. It's fun to be invited to this call. It's certainly not a place I ever expected to end up. I was born poor and I didn't care. We actually lived in a school bus, kind of on the sort of outskirts of outback Australia for a while, and very blue collar, a real country bumpkin, but always kind of curious about nature and a bit of a bookworm. Never thought I would go to college, but actually did a couple of years of volunteer work in the US, and I was inspired by you Americans who are just so like goal driven, and you all go to college. I said, okay, I guess college isn't just for bums and losers. So I decided to study what I enjoyed, right? It was never driven by money, same thing. So I studied chemistry. Being in Australia, I was always fascinated, like how do koalas eat those gum leaves that are full of terpenes, and like, why do these spiders have such nasty venoms and everything's trying to kill me? So I was really interested in natural products chemistry. So I did a degree in chemistry, and it's like using all these like synthetics and sort of building stuff, but man, nature just does it all by itself. So I became then interested in photosynthesis and did a master's in that. Then sort of thought I really like biological activity of these actives. So I did I did some free radical biology research. I was sort of doing cancer research for a while. Then I did a PhD in immunology, which that was kind of fascinating, because the first thing that you learn is that these immune cells, and there are lots of different kinds, T cells, B cells, macrophages, neutrophils, they have this language, and the language is these small molecules, these peptides and proteins. They're called chemokines and like interleukins and natural killer factors, and they're chemokines, cytokines. Like, this is the language. And so I became fascinated with that, and then sort of dedicated a postdoc at the National Cancer Institute in cell-cell communication. Like, this is their language. It's fascinating. So long before peptides were popular, that was kind of what I was really digging on. I left the National Cancer Institute because I had this sort of epiphany that all of the drugs we were working on were actually inspired by plants. And so, the motif is like, find it in the plant and basically modify it so that it's a really potent chemotherapeutic. And my thought was like, well, why not just get it from the plant and use it before you're sick? So that led me to completely sell out and go and work for the nutraceutical industry. That was about 30 years ago. So I started at Nu Skin and sort of helped them sort of build out these formulations that were very heavily focused towards phytochemicals, right? Standardized, polyphenols and carotenoids and things like that. Became super fascinated in that. And we came across this ability to measure carotenoids in the skin non-invasively. So I helped that company spend, man, at least $70 million. You want me in your company to help you spend money. So it was like $70 million to develop this technology that helped people sort of get a measure of how good is your diet. Tracy knows all about this, right? And Paige, are you eating enough fruits and vegetables? Do you have too much body fat? Are you smoking? Like, carotenoids tell you all this stuff. It's very cool. So then I kind of changed tack a little bit. Some things happened in our family that made me sort of go a more spiritual, metaphysical approach. So I joined a essential oils company. Like, wow, now he's just gone from like real research to nutraceuticals, which are pseudoscience, now like way over into like spiritual, metaphysical. But the science of scent was fascinating. Like, again, it's plants making molecules that are for protection and antivirus. But I was fascinated with the olfactory bulb and how it translates those aromas and goes to the primitive part of the brain, the amygdala, that's associated with memory and all that kind of stuff. So I was really kind of digging on that for a while and loving it. And then I got a call from Truman and he said, "What do you know about peptides?" And I'm like, let me think. Didn't I do that in the 80s and 90s? So here I am with you guys. That's my background. And man, I'm so glad I'm here. Like, I don't have to work, except that I think I lose credibility with my wife if I just drift. So I just love being with Make Wellness, and thanks for making me feel welcome here. This is
we are blessed to have you here. So let's dive into some of the slides that you sent me.
Okay.
And talk a little bit about sleep recovery, and then how Restore is going to be, one of those things that's going to impact pretty much everything we do.
Yeah. So, I don't always necessarily feel pressure to live up to expectations. So I don't know how deep we're going to get here, but
we can go a few minutes over, because we got about 10 minutes now, but we can go 15. Let's do that.
Let me just give you a basic primer here. Like, I'm happy to come back again and talk sort of more in depth about the product and stuff, but let's just talk some basics here. So here you can see like the different wavelengths that you can sort of measure from the human brain during the wake state and the sleep state. I love this. So your normal waking state is beta waves, and then just before you get sleep, as you're starting to get sleepy, you see these alpha waves. They're a little bit sort of longer wavelength, deeper amplitude. And then you get into stage N1 sleep, theta waves. Like, this is a real creative space for the brain. And then you see here stage 2. Stage 3, I'm just going to focus a little bit on stage 3, slow wave sleep. This is really deep sleep, delta waves, and REM sleep, which looks like this is kind of the dream state, right? And so beta waves. It's called paradoxical sleep, because if you see, it looks like the normal waking state, but you're not, you're asleep. And in fact, in deeper parts of the brain, it's also theta waves. So this creative sort of slower wave. So cool stuff is happening while you're sleeping. And I want to just sort of share that with you a little bit. So during your REM sleep, like, let's go there first. I can't remember what slides I had now. I gave them
you want me to go to the next one?
No, let's just stay here for a minute. Okay. So during REM sleep, you see that it's kind of like this paradoxical sleep. This is really cool. For years and years, people are like, what's REM sleep all about? Why do we do that? And for a while, they just thought, well, it's just something that happens, while you sleep, and we can't figure it out. But now we actually know that it's super important, that this is a part of this dreaming is not just accidental. It's like deeply tied, now we understand, to emotional processing, memory regulation. It's kind of a safe space because the brain shuts off norepinephrine. So you kind of lose the stress markers. Brain also shuts off power to the muscles. So it's a muscle atonia. You're literally paralyzed. And the brain is working stuff out. If you guys are super interested in this, read Matthew Walker's book, Why We Sleep. Like, it is an easy read, and it's absolutely fascinating. He's a neuroscientist and a sleep expert. Why we sleep. But there are studies, just sort of to give you an idea of how important it is. For example, the next slide shows a really nice study by Scarpelli et al. In 2019, kind of focuses on like the importance of REM sleep. And here's just one of the things, right? If it's disrupted, it's linked to emotional dysregulation and mental illness. Like, it's something that we really need. So REM sleep, super important. The next, if you go to the next slide again, let's talk about deep sleep. This is fascinating because, in this deep sleep where you have these really slow waves, have you got you got the next slide, haven't you?
Is that the right one, or you want me to go one more?
No, that's right. Yep. So you see, these are really deep. Like, it's kind of unusual. Here's something really interesting. My daughter is a neuroscientist and she's a pediatrician. And I kind of said, hey, I'm really interested in the lymphatic system right now. And she said, what's that? Well, this is such recent research, right? In the last 10 years, they discovered this. You all know what the lymphatic system is. We know that it's this whole separate vasculature that helps to sort of clean the body. and sort of recycle the junk and stuff. But they have not, there's no lymphatic system in the brain. And it was around 2012 that a Swedish researcher discovered that the brain actually physically changes its structure when you're in slow wave sleep, not the other sleep. The brain's floating in cerebrospinal fluid, and it actually shrinks a little bit, and there's a space between the vasculature. It's called the perivascular space, and it's enhanced by these glial cells. And what happens is it enhances actually this during deep sleep. Only through slow wave sleep, you get this flush of cerebrospinal fluid that washes out the toxins from, and all the buildup and all of the sort of the protein, sort of sticky proteins like amyloid beta and tau protein from the day's sleep. So let me see, I think, slide 5. This kind of is a diagram of it. Obviously, you don't have time to sort of dig into it right now, but so interesting. You look at the green there. This is kind of what's happening as the cerebrospinal fluid is flushing this out. And so if you're not getting deep sleep, you're not cleaning your brain. And what, again, it blows me away that we've only known this for like a decade. But this and the REM stuff kind of really helps you to appreciate, like, wow, you need to go through these sleep cycles. The next slide is just, sort of how my brain thinks. It's like, okay, during the day, you've got all these toxins and things that build up. And as you sleep, gradually, you end up sort of every morning with a clean brain, theoretically, if you've had enough. And this part shows that there are several cycles through the night. And so if you're sleeping, you've got to try to support those cycles. And a lot of people aren't sleeping. And so they take sleep aids, a lot of which are sort of sedatives. And the studies are showing that the sedatives knock you out, but they don't allow the support of the normal sort of sleep cycles. And so you don't get into REM and deep sleep the way that you should. So you really have to pay attention to, how you need to sleep. So what have we got on the next slide? Okay, so here's another thing that's kind of interesting, and it's in the context of fit and muscle, is like all sorts of other things happen during deep sleep. And one thing that's really important is that's when the brain gets the message from growth hormone releasing factor to release growth hormone, so that your muscles then can repair and sort of get the message that it's okay to stay, to inhibit sort of the production of myostatin, which would normally break down the muscle. So while you sleep, if you're not sleeping properly, if you're not getting into slow wave sleep, you're actually kind of robbing your muscle. So, as much as you go to the gym, you're going to lose that work if you're not sleeping correctly. And like really good athletes, I think it was Nate that told me this, like really good athletes actually need a lot more than 8 hours of sleep.
Yeah. Well, and a lot of times they train themselves to take naps, even if they don't feel like they need them in the middle of the day, because it helps their performance so much better.
Yeah. Yeah. So that the growth factor sort of hits these receptors on the muscle about probably the same growth factor that the fit peptide binds to. So sort of going through that mTOR switch box sort of gives the muscle permission to stay there and to grow. And so that's a super important part of your muscle. And so when you think about it, when you think about sleep or a product for sleep like Restored, there are big arrows pointing toward the muscle and the support of fit, right? And actually even lean, because we won't go into a great deal of detail right now, but if you don't sleep right, your body actually looks more like that of a diabetic in terms of its metabolic function, right? It just like your glucose response isn't as good, your ghrelin's up, your leptin's down, you feel more hungry. And so there's a big arrow for sleep pointing towards leanness. So if you want to be fit and lean, you really need to sleep. So that's kind of the take-home message about the importance of sleep. And if you go to the next slide, it really just shows you sort of how does this work? How does this peptide work and where does it go? Boy, that must be a big slide. Okay, so a lot of it's related to cortisol. Let's go to the next slide just to keep it short and on time. So, normally during the morning, cortisol goes up. It's kind of a fight or flight response, but it's also helping you to wake up in the morning. So there's a normal morning peak and little stressful events happen during the day, but by the time you're ready to sleep, it should be low. The problem is that a lot of people these days, the stress doesn't end. right? We're in fight or flight mode all the time. We work too hard. We work long hours. The lights can be on 24/7. I mean, it's dark outside. If this were a couple of 100 years ago, I probably would have been, packing up and asleep by now, but we're not. We're all up here talking. I don't know if any of you are on the East Coast, but man, it's late. You should be in bed. So, this kind of thing doesn't support sleep architecture, especially chronic stress. And this is where the peptide binds. It binds to orexin receptors on the top of the kidney there, on that little hat, the adrenal gland, and sort of helps to calm that down and sort of support normal sleep. And the last slide just shows you that we also have some support ingredients there that are important we always sort of try to put together a matrix of support type ingredients, like here GABA, L-theanine, and apigenin. So I think it's 8:01. I think
that's actually, that was very impressive. So let's end with this. I know you guys did a sleep study, a case study with 100 of affiliates that you guys essentially didn't even pick because it was based off of them hitting a certain level, right? So give us just kind of a rundown of like what you found in those case studies.
Yeah, that was like an acid test study because entrepreneurs like you guys are like herding cats, right?
Yeah.
You just do your own thing. You're on holiday, you're working, you don't follow orders, like you're not compliant at all. Like doctors are the worst, right?
Yeah.
And some of our people slept really well, and some people didn't sleep well. Normally when you do a study, you control everything. Like if you're conducting a study, you're a control freak. So you would normally exclude people that are already sleeping well, and you would exclude anyone that sort of didn't follow the protocol beautifully. But we got some great results from this study. We learned a lot. I think one of the big take homes was we learned that a lot of people were saying, man, like the full dose is too strong for me. This peptide really works. And so the first thing that we learned is, like if we want this in the real population of everyday people, I think that the half dose is sufficient. Another thing that you should know is that like this is so cutting edge that yes, we've been working with Neurotest. They're the guys who did the AI and all of the in silico modeling and found that peptide and did the clinical study. That study is not even published yet. So they have 2 studies, not even published. We read the manuscripts. Let me share that with you before we launch this product, because yes, we do need to vet these products. But this is kind of, I guess, what we live with when we're on the edge and we want to sort of claim our stake on natural peptides and give it to you right hot off the press. So that study will be published, and we will, we've given you sort of some basic results from what we've done, but we've got a lot more data that we need to sort and share with you. And we'll do another study as well. I think a sleep study that we do that's properly controlled will be really important.
Yeah, I love that. Well, hey, thank you so much, everybody that spoke today. I mean, how much value you guys give, and just education and helping us kind of, shape our minds to point us in the right direction on how do we impact the most people possible. We do these meetings once a month. The next one is going to be on November 13th. So we meet on a Thursday. We'll be on a trip. The company will be on a trip on the 6th. They usually do it the first Thursday of the month, but we're going to move it to the 13th. That will be the day after we launch the Restore product. And so maybe we'll have you back to really dive into that and just give us some more clarity so that we can really push that out there and get change a lot of lives and get people to sleep. So, well, thank you guys so much. And we will let you go. We're 4 or 5 minutes over. We'll see you soon. Remember, if you want to share this with somebody else, as of 10 a.m. Pacific Standard Time tomorrow, it will be, the recording will be in the back of the book. So you guys can always share that. And just love you guys and really appreciate you. We'll talk to you soon.
Thanks, Nate. Thanks, Dr. Bartlett.